Good morning, everyone. I'd like to welcome you all to the RUHRA Consultation, or the Regional Unified Health Research Agenda Consultation and Updating with Stakeholders. Before we proceed to the program proper, I'd like to introduce our special attendees for today. So we have a number of participants from our municipal health officers from different municipalities, and I won't be introducing each one of you because we have a number of them here with us today. We have also invited and is present here with us today our VPs and research directors from different academes in Eastern Visayas. And I'd like to introduce our regional, the Department of Health OIC Regional Director, Dr. Exupira Sabalbarino, and she is also the chair of the Eastern Visayas Health Research and Development Consortium. We have also here with us today, of course, the chair of the Research Management Committee, Mr. Linido P. Olobia.
Morning.
We have also here with us today our consultant for today's activity, Mr. Teddy Dizon. She will be further introduced later on. We have the Secretariat of the EVHRDC. We have Raymond Campo, April Rose Amor, Jake Margallo, and yours truly, Daniel Ann Escobar. And also, we have our very supportive coordinator, Ms. Jim Gay Oragub. And here with us also today, our research staff from the Department of Health, Mr. Milbert Flores. So Ben, I'd like to turn over the floor to you.
All right, thank you, Ms. Escobar. Once again, thank you everyone for taking the time off your busy schedule to be with us and work with us today and tomorrow, of course. We are still expecting more participants from the different local government units. I hope they can join because their inputs are, truly vital in this activity. By the way, before we move on to the next part of the program, may we request everyone to please fill out the attendance form posted in the chat box. I believe one of our staff had posted it earlier. All right, so to take off this two-day activity, we have the chair of the EVHRDC Executive Committee, the OIC Regional Director of the Department of Health Eastern Visayas Center for Health Development, Dr. Exupira V. Sabalbarino, to deliver an opening remarks. A virtual round of applause, please.
Good morning, everyone.
Good morning.
Good morning po. Good morning. So it's nice to see you back again. First, I would like to great good morning to all the members of the different EVHRDC committees, my co-chair, Director Ernesto Granada, Dr. Lucia Daos, our director, Mr. Olobia, our RMC chair,
Hello.
research directors of the different issues in the region, our program managers from the Department of Health, and of course, to our municipal health officers from the different local government units in the region. So it is my great honor to welcome you all this morning as we start with our RUHRA consultation and updating with stakeholders. Every year, the Department of Health provides guidance on regional health research priorities, anchored on our mission vision of the Department of Health, especially now as we are into implementation of the universal health care. So our health research priorities in the region will be based on the new developments happening in the country and how it is transformed in Eastern Visayas. This is done to ensure alignment to our Eastern Visayas Health Research Development Consortium vision, mission, and objectives towards the development of Eastern Visayas. I hope that this activity will be very fruitful and hope that we will have a very interactive discussion towards coming up with prioritization of the updated regional health research agenda for Eastern Visayas. So in behalf of the Eastern Visayas Health Research Development Consortium, EVHRDC, I welcome you all. Good morning, everyone, and let's all enjoy our two-day activity. Thank you and good morning. Back to
Thank you,
you, Ma'am
Dr.
April.
Thank you, Dr. Sabalberino, for that welcome message. And now we have the EVHRDC coordinator to further explain the reason why we are conducting this activity. Please welcome Ms. Jean Gay O. Rago.
Thank you, Bem. So good morning, everyone, to Dr. Sabalberino, to Sir Ding Olobia, to Ma'am She Labid, and to all the participants from the rural health units, local government units, and from the academe, and to all the members of the EVHRDC committees, and to the Secretariat. Good morning. Okay, so just to give you a brief background, since Sir Ding Olobia will be presenting this later, the Philippine National Health Research System, or the PNHRS, launched the National Unified Health Research Agenda, or the NURA, in 2006 to serve as the country's template for health research and development efforts, specifying the areas and topics needed to be addressed in a 5-year scope. The NURA is a product of a series of regional and national consultations with stakeholders and consolidation of research priorities of the 4 core agencies of the PNHRS. It is regularly updated during the mid-period of the 5-year agenda. Anchored on the principles and goals of PNHRS, the Eastern Visayas Health Research and Development Consortium, spearheaded by the DOH Eastern Visayas Center for Health Development and the DOST VIII, has developed the 2017 to 2022 Regional Unified Health Research Agenda, or the RUHRA, in recognition of the diverse and specific health needs of the region. Since these research needs are dynamic, the consortium conducts a yearly consultation with stakeholders in the region to ensure that topics relevant to the needs of the region is included in the agenda. In relation to that, this 2-day activity is conducted to determine the health research priorities of the region, to create a list of areas for health researches that need to be studied, to revisit and update the Regional Unified Health Research Agenda, and to develop advocacy and monitoring and evaluation plan. Just like the other consortia, we at the EVHRDC involves various institutions from the academe, hospitals, and private and governmental organizations. We establish linkages between the researchers and institutions, as well as promote health research activities attuned to local health needs, which is why we have invited participants from the different LGUs and RHUs, because they have been our partners in identifying issues and health concerns among municipalities for possible research studies. Also, we ask the research directors from the different SUCs and HEIs, as they are our counterparts in developing health researches for studies and for further use in the region, to lead in the generation and utilization of knowledge, innovation technology, products, and services in promoting the optimal health and improving the quality of life of the people in Eastern Visayas is the mission statement of the EVHRDC. As the consortium coordinator, I am looking forward to the success of this two-day activity. Thank you so much, and let's be productive. Thank you, Bam.
Thank you, Ms. Ragub. Yes, this consultation and updating of the Regional Unified Health Research Agenda is a yearly thing. That's why we really appreciate your continued cooperation and support to make this activity a success. We also believe that your vast experiences in public health are truly valuable in updating the priority topics or researchable areas, which will be the basis in approving proposals for funding by the EVHRDC. Speaking of the EVHRDC, you might have or might have not heard about it yet. So we have one of the EVHRDC staff to tell you more about it. Please welcome Mr. Raymond Campo.
Thank you, April. Good morning, everyone. As what April mentioned earlier, there might be some of you who are not yet familiar of what EVHRDC is. So I would like to present a very short presentation of EVHRDC, especially for those who are not that familiar, coming from the LGUs, RHUs, and the different VPs, and from our member institutions from the academe. So for my presentation, I will be focusing on this outline. We'll talk about who EVHRDC is, our vision, mission, and goals, our organizational structure, the different committees that comprise the consortium, our member institutions, and our accomplishments through the years. So EVHRDC is actually a framework. Our framework is mirrored and linked to the Philippine Council for Health Research and Development, institutional development programs. So we're here to encourage and promote health research activities in the region. Our mandate comes from Republic Act number 10532, otherwise known as the PNHRS law. It's an act institutionalizing the Philippine National Health Research System. Just a quick glimpse of the history of the consortium. Around 1982, that's when the Philippine Council for Health Research and Development through DOST 8 and the Department of Health 8 organized the Regional Health Research and Development Consortium 8. So at that time, we were called RUHRDC 8. There were not a lot of activities for health research at that time. Around 1994, that was the time that the RUHRDC was then revitalized, and the consortium became more active in conducting researches and capability building activities. Around 2002, that's when we adopted the name Eastern Visayas Health Research and Development Consortium. Our vision is very simple. We want to be a transformative health research consortium in Eastern Visayas. And that will further help us achieve our mission, which is to lead in the generation and utilization of knowledge, innovation technology, products and services in promoting the optimal health and improving the quality of life of the people in Eastern Visayas. In EVHRDC, we believe that through health research, we'll be able to utilize the results of those researches and ultimately help improve the quality of life of the people of Region 8. Our goals, very simple. We want to increase research productivity. So we have a lot of activities, a lot of trainings that help our researchers in order for them to come up with more capsule and full-blown proposals for the conduct of the research in the region. We're also here to strengthen and sustain collaboration and cooperation among member agencies and stakeholders, As of the moment, we have 31 member institutions, which I'll be showing more later on. And we have different committees, different events, and capability building activities to strengthen that the partnership we have built through these years. We also would like to mobilize and complement health research resources. I'm proud to say that the Eastern Visayas Health Research and Development Consortium has the most number of health researches that were conducted in all the region. And that's primarily one of the reasons is because we have two funding agencies who are there to really help out in funding the operation of EVHRDC and as well as funding research projects. That will be the Department of Health, Eastern Visayas, and the Philippine Council Health Research and Development. They are our funding agencies. We're also here to enhance utilization, protection, and commercialization of research products. Of course, after research is completed, it doesn't end there. We need to disseminate it and for the general public to utilize it. So we have conventions, assemblies to ensure that the stakeholders will hear more about the advancements and the results of this research. Along with that is very similar, this event as well. We would like to talk with our stakeholders as well when it comes to the research priorities for the region for this year. We would also like to strengthen the capability of member institutions in health research and development. We visit our member institutions to check how research ready they are, and if there are needed trainings and help required, then our committees will definitely help them out. And lastly, we are here to advocate and support the health research culture. We do our yearly regional health research symposium where we showcase the the different results of projects from professional level to our students as well, to support again and to advocate that health research is the way to go if we want to help improve the health of the public in Region 8. This is the structure of our consortium. I believe some of you were already here when the institutional video was playing. So again, our Monday comes from PCHRD, and we have different committees under that, 6 committees to be exact. Our EVHRDC, the general direction comes from the executive committee, which is chaired by the regional director of DOH. Of course, we have our OIC regional director, Dr. Exuperia Sabalberino, also co-chaired by the regional director of DOST. That's Director Ernesto M. Granada. Along with them are the members of the executive committee from NEDA, St. Scholastica's College of Tacloban, UP Manila School Health Sciences, CHED, and the Visayas State University. Then we have our consortium director, Dr. Lucia P. Daos, who is the link that connects the executive committee to the secretariat and the different committees that helps operationalize the consortium. Of course, the secretariat headed by our coordinator, Ms. Jean Gay Orado. So we have 5 different committees under that. Our research management committee, Mr. Leonidio P. Olobias, the chair, who is with us as well, who will be presenting later on. So they will be the one to, they're the one responsible for generating health research projects in the region, along with their, along with what they do is similar to what we have right now, which is the RUHRA consultation. We usually start our year with this to set what are our health priorities for the year. Then the research management committee will do call for proposals, research proposal enhancement workshops to help the researchers further enhance their research, and then they review the technical aspect of the paper up until the time it's approved, and then RMC will also be the one to monitor the progress of that report and the project until it is completed. Then we have our Ethics Review Committee chaired by Dr. Jane R. Borinaga from EVRMC. So if RMC is the one who reviews the technical aspect of the proposal, the ethics will check on the ethical soundness of the proposal. How well do the proponents do to protect the participants, especially if they have human participants. So they're the ones who approve and provide ethical clearance for projects with or maybe low risk to medium risk or high risk, especially those who have human participants. Then we have our Research Utilization Committee, who's chaired by Dr. Sherry Ann Labid as Summer State University. Of course, they'll be the one to help disseminate the different results of the projects we had to the public. They're the ones who lead dissemination forums, the Regional Health Research Symposium, in order to advocate more health research in the region. The fourth committee is the Capacity Building Committee, chaired by Dr. Virgildo Isabalo of UP Visayas Tacloban College. Of course, they're the ones who help capacitate not just our representatives from our member institutions, but also the researchers we have. So they help with enhancement workshops, if there are needed trainings for our researchers, like publication, how they can help for publication, on writing their manuscript after, and even during the process as well of writing their proposal. We have different activities for that, courtesy of the Capacity Building Committee or CBC. And then lastly, our SOME, or the Structure Organization Monitoring and Evaluation Committee, is chaired by Ms. Josephine L. Hipe Pitak. So they're the ones who maintains the structure, the different member institutions. If there's if there's a new member institution as well, or a new institution who would like to be a member. In fact, we have one we're processing right now who would like to join EVHRDC. So there are the ones who handles that. Also, they do visits to our different member institutions to check their research capability. And if we see that there is a need to help, then the other committees as well will be able to help that specific member institution. So that's the structure for EVHRDC. Our member institutions, I mentioned right now we have 31 member institutions. So we have 16 from the academe. Then we have 8 government agencies as well. And then 7 from health and professional organizations. Very quick, I would like to show some of the accomplishments we had for the past years. Of course, we were affected by the pandemic last year, but that didn't really stop us from still engaging and making sure that health research still continues in the region. So we still, just like what we're doing today, we utilize the Zoom platform or other online platform to continue our different activities. But for the pictures, I'm just showing face-to-face pictures for the past few years because it's better to look at. So these are examples of call for proposals or institutional visits. This is usually done by the Research Utilization Committee and SOME. These are examples of our EXICOM meetings where they discuss the general direction of the consortium. I mentioned earlier, our Capacity Building Committee with the Research Management Committee helps with the Proposal Enhancement Workshop. So when our researchers submit their proposals, it just doesn't stop there. We help them enhance and further improve their proposals. Early 2019, we held our first workshop for biomedical engineering device research. And in 2020, we were able to further approve one proposal for biomedical engineering. This is way back 2019, when we attended the PNHRS week. Unfortunately, last year it was canceled, so we didn't have that celebration. Examples of review of proposals done by the Technical Review Board under the Research Management Committee and the Ethics Review Committee. These are some of the pictures of our committee meetings. Of course, once our projects are approved for funding, we also do progress reporting to ensure that the line item budget and the MOA was followed by the proponents, and also to further check if there are opportunities or assistance needed by our proponents in implementing their projects. Here's an example of the mid-year assessment spearheaded by the SOME committee. Of course, we make sure that our committees are following their work and financial plans. So our SOME checks on that as well during the mid-year and the end of the year. An example of a dissemination fora, last 2019, we were at Robinson's and attended the Science and Technology Livelihood Summit, where two completed research and the results were shown and to the public. Last year, we also have done that during the National Science and Technology Week through an online platform. Here's an example of how we advocate health research culture. We've done research, a regional health research symposium spearheaded by our research utilization committee. Last 2019, we had it in Hotel Alejandro, Tacloban City. This is in Summit. And also last year, we've done it as well, our first virtual regional health research symposium. These are some of the visits done to our member institutions, handing in of funding assistance to our proponents. I mentioned we regularly join the PNHRS week, and during that time, there are also competitions there, and we regularly join, and we regularly also win those competitions. These are some of the competitions we had in Iloilo last 2019. There were two competitions as well, 3-minute pitch and the poster exhibit contest, in which we bagged first place for both competitions. Last year, we renewed our accreditation for our Ethics Review Committee from the Philippine Health Research Ethics Board. We are level 2 accredited, which means our ethics committee can review all types of proposals except those that requires clinical trials, because that's for level 3. That's the next step. Last year, we also were a finalist of the Government Best Practice Recognition from the department, from DAP. So there was, I believe, 70 plus entries, and we're part of the 20 plus who did present. We did not win at that time, but we'll definitely join again to be part of the top 10. We're definitely part of the top 20 plus who presented in the panel of judges. So those are just some of the accomplishments and awards we had for the past few years. This is our website in case you want to check it. Our Facebook page is also active, and our email address is listed down below if you have any inquiries, or if you're a proponent as well who would like to reach out and maybe talk about submitting a research proposal, then we can definitely assist you with that. Thank you everyone for listening. That's the end of the presentation.
Thank you, Raymond, for that very informative presentation. Oh, by the way, just a heads up, we will use Mentimeter. This is an online interactive presentation software to answer questions and surveys as part of the discussion later. We will post the Mentimeter link later in the chat box, so please watch out for that. All right, so earlier during Ms. Raglub's explanation of the rationale of the activity, she briefly tackled the Philippine National Health Research System, or the PNHRS, and the National Unified Health Research Agenda, or the NURA. So to give us a more detailed discussion of these two, we have the Research Management Committee Chair from the Department of Health Eastern Visayas Center for Health Development. Please welcome Mr. Leonido P. Olovia.
Good morning, everyone. So again, I would like to express my, before I conduct my lecture, I would like to thank the participation of other agencies and partners, especially our LGU municipal health officers. I think many of them are not familiar with the operations of the health research program in Region 8, and this is a very good opportunity for them to participate today. Okay, so let me present the Philippine National Health Research System and the NURA, or the National Unified Health Research Agenda. Okay, next slide, please, April. So what is the PNHRS, or the Philippine National Health Research System? So it was explained earlier that the Philippine National Health Research System is a system which assures quality health care for Filipinos by ensuring that health research is linked to the needs of our health systems. So you might ask, how is the health research linked to the health research systems? It means that the scientific evidence generated from the health research usually leads to basis for evidence-informed policy. So at the national level, if you can realize, the researches that are done by big ticket projects serves as the basis for the passing of laws in the Congress, even in the Senate. So that's how contributory is the health research output. So, but that does not apply in our region. And later on, you will be able to realize that health research is also related to our public health programs. So the PNHRS aims to generate research funds sufficient enough to finance the training of more health scientists. And for the region, it is the Philippine Council for Health Research and Development from DOST and DOH, which contribute together to generate funds for the conduct of research. Provides the necessary resources for undertaking health research aligned with the country's NURA, or the National Unified Health Research Agenda. Its governing council has members that represent relevant sectors of society. Next slide. So DOST and DOH are core partners, agencies. It initiated the creation of Coordinated System for Health Research, or the PNHRS, to contribute to the goals of an improved quality of life of Filipinos, which formally began last 2003. So it's almost 18 years ago when DOST and DOH collaborated to come up with the PNHRS. And as mentioned earlier by Mr. Raymond Campo, we already have a law that governs the PNHRS, which is the Republic of 10532. Okay, this was this became a law last 2013 when it was published in Manila Bulletin and became effective on June 2013. And its IRR came last 2013 of November. Next slide. The core agencies of the PNHRS are the Department of Health, the Philippine Council for Health Research and Development, DOST, and the CHED, and also the National Institute of Health, or the UP Manila. Next slide. So this is the National Unified Health Research Agenda. Okay, it was in 2006 when PNHRS launched the National Unified Health Research Agenda to serve as the country's template for health research and development efforts, specifying the areas and topics needed to address in a 5-year scope. So if you will realize from 2006, I think around 3 presidents already were witnessed this the evolvement of the NURA from the time of the previous president until the current administration of the Duterte administration. Next slide. So the NURA is a product of a series of regional and national consultations with stakeholders and consolidation of research priorities of the 4 core agencies of the PNHRS. It's regularly updated during the mid-year period, the 5-year agenda, to account for research developments. So you might wonder, bakit yung RUHRA dito sa Region 8 ginagawa naming yearly? Magkakaiba po ang yung NURA is mid-year. So in the 5-year period, mid-year. So sa RUHRA, it was agreed by the consortium members that we should update the RUHRA yearly to account for the developments, recent developments, new directions on trust. The updating takes into consideration the MDG, Midterm Philippine Development Plan, and various national health plans anchored on every presidential term. So, okay, this means that the health research results are really inculcated in the major frameworks that we use in the government, like this MDG or the current SDG now, the MTDP or the medium-term development plan. So the evidences generated from research are observed or documented in these different national health plans. Okay, next. So the NURA, for the current administration, 2017 to 22, so these are the research priorities. The first one is the responsive health systems, or researches that aim to produce evidence toward efficient, quality, safe, and affordable health care. Please be reminded that the NURA, what appears there is actually the topic only. And you might, especially for our LG partners, the researchers that are usually done in the region by the national scope research are usually anchored also on the NURA, meaning to say, if they conduct the studies in your area, municipality, so these are one of the samples of the national study, and that study that was approved is also anchored in the NURA. So ibig sabihin, pag gumawa sila ng study sa national level, yung mga Filipino researchers, it's also anchored in the NURA. So that is what it means when we're saying that what we are explaining the NURA. So under the responsible systems are the following: health governance, health financing, access to essential medical products, vaccines, and technologies, health information systems, health service delivery. So these aspects, itong mga binanggit na 6, these are health system building blocks of the WHO. Itong 6 na to. Okay? Then the rest are health human resources, health economics, health research management. Okay? Next slide. Research to enhance and extend healthy lives. Okay, researches that aim to produce evidence towards the prevention of disease, restoration of well-being, and reduction of disease burden. So there's adolescent health, communicable diseases, environmental health, maternal, newborn, and child health, mental health, non-com, nutrition, oral health, and reproductive health. Next slide. Holistic approaches to health and wellness. Researches that aim to produce evidence geared towards the application and recognition of traditional, sociocultural, and alternative approaches to health in addressing health system gaps. So yung mga studies related to traditional medicine sa PTAC, if you're aware of that, yung mga traditional practices are anchored on this theme. Ito mga theme po ang tawag dito, they are called themes. Determinants of health or factors that influence the health status or health conditions. Halal in health, health behaviors. Okay, next slide. We also have health resiliency, researches that aim to improve the ability of the country's health system to be resilient with respect to emerging global and domestic threats. So under this includes accidents and injuries, climate change, disaster risk reduction and health emergencies, emerging and re-emerging diseases, environmental threats to health, occupational health, and migration. So this explains that even if these priorities are national in scope or national agenda, some of this agenda you will notice are also priorities in our region. Okay, which will be explained later by our resource person, which is now the RUHRA. Okay, next slide. We also have global competitiveness and innovation in health. So researchers that aim to promote research as a tool for creating novel solutions to existing and emerging health problems through technology development. If you can remember, the diagnostic kit for COVID that was developed by Dr. Distura falls on this theme, particularly the diagnostics. Okay, so Dr. Distura was also the author of the dengue test in rapid diagnostic test for dengue region 8. No, or the NAAT lamp. Functional foods, information and communication technologies for health, biomed and engineering, and omic technologies. Next slide. Research in equity and health. So researchers that aim to produce evidence to enable the health system to respond to health needs and develop new solutions for vulnerable populations and marginalized sectors of society. So this includes research related to disability, gender, GIDA or the geographically isolated disadvantaged areas, geriatric care, HIV/AIDS and other STIs, indigenous people, substance abuse, violence, and other vulnerable populations. Next. Okay, so that's all for that. So these are the 6 themes of the National Unified Health Research Agenda. Thank you very much.
All right, thank you, Mr. Olobia, for that presentation. Like we have mentioned earlier, we conduct this activity every year since these research needs are dynamic. The only difference for this year is that we have invited a public health practitioner who provides consultancy services and technical assistance such as research and development project management, strategic planning, health research, agenda setting, health policy, and system research. So without further ado, let me now give the floor to our resource speaker from Alliance for Improving Health Outcomes, Mr. Teddy S. Deason. A virtual round of applause, please.
Thank you, ma'am. So, good morning to everyone. Nakaka-pressure kasi ang galing mag-English ni ma'am and may magandang tone pa. So, good morning, everyone.
Good morning po.
Hopefully, I can provide some things that is substantial enough so that we can update our regional unified health research agenda. So I think we have pre-work na ginawa for the RUHRA updating. So basically, the pre-work is about soliciting everyone the topics or the priorities, perceived topics or perceived priorities of the region based on their experience, based on their practice, based on their locality. Unfortunately, we yield a lower number of results. That's why we need to conduct another round of discussions with you. This one, we will be using Mentimeter so that everyone can participate in this interactive presentation or even discussions. So I am now sharing my slide. Can you see it, ma'am? Or can you confirm that you can see the
Yes.
slides? Okay,
Yes,
thank
very good.
you. So basically, this is for the updating of the Regional Unified Health Research Agenda or the Regional Health Research Agenda. So a gentle reminder, please close all applications except for your Zoom and internet browser. Please participate actively and provide perspectives in our discussions. Then we will use Mentimeter to document results on the topic generation. This will ensure accountability and transparency whenever we update the Regional Unified Health Research Agenda. So hopefully this will be the practice of every region because as mentioned, there is SOME at the national and even at the regional level. So the SOME can also check whether or not the RUHRA is responsive enough aside from the RMC. So moving forward, here's our Mentimeter code. I hope that our secretariat can provide the Mentimeter code. You can just type in menti.com and then type in this codes, or just type menti.com and then type in the code 3394783. Or if you have cell phones beside you, you can just scan the QR code so that dediretso na po, i-direct na po nila kayo sa ating mismong slide. In our Mentimeter, you can see the same slide sa Zoom at saka sa ating Mentimeter. So lumalabas lang po yung voice dito sa Zoom, but sa Mentimeter wala po. But only the slides. So moving forward, for the updating of the Regional Health Research Agenda, I'll follow series of flow. So number one is the introduction of health research agenda setting. Number two, how to ensure or what to ensure in aligning our health research agenda at the regional level with the national level. Next is the generation of health research topics. So basically, this is the interactive one wherein you will provide us answers or perspectives by typing in or keying your perspective or answers. And then the next steps. In the next steps, I will just mention this during the introduction phase, because in the introduction phase, there are phases on how to update or develop a research agenda. Moving forward, for the introduction, based on the PNHRS guidelines, we develop, IHO team developed the guidelines for health research prioritization from different international and national frameworks. So there are three phases. The first phase is preparatory phase. The second phase is the implementation phase. The third phase will be the post-implementation phase. We will be dealing with the two. Actually, kanina po, they provided some situational analysis, some situations wherein ito po ay based doon sa context ng region. That's why we need to contextualize what are the research priorities in our region based on the local experiences and even local health needs. Aside from that, in our interaction later, we will ask you your name and affiliation, but in the coding process, we will delete your name, but dito po, ang gagawin po natin, yung affiliation nyo po, ang titignan po natin kung saan po kayo affiliated. For example, government, and then dito academe, or academe and then private. So ilalagay rin po natin iyon for transparency purposes. Basically, that will be presented tomorrow. Next, implementation phase. For the implementation phase, basically this is the second and third na ating gagawin. Ito po ay yung topic nomination and criteria setting and prioritization. For criteria setting and prioritization, that will be our day 2. So we will end lang po sa topic nomination, wherein you will just key in your topics, and then tomorrow I'll present po the streamlined and the thematize topics or health research topics wherein we will rank it accordingly. So, but before everything else, we need to really identify whether or not we need to basically update our RUHRA. There are 4 questions or 8 questions for that matter na kailangan po muna nating sagutin. Later, we will discuss that and kailangan po rin nating sumagot as stakeholder. So next, ito po based sa ating guidelines on for health research prioritization, there are questions. Like for example, have there been any changes on epidemiological landscape, socioeconomic landscape, political leadership, and health policy environment? These are the 4 key questions we need to really check before we proceed with the updating of the Regional Unified Health Research Agenda. Although it might seem na kailangan nating i-update agad, but we need to undergo process so that everything will be documented and everything will be transparent to our stakeholders and everyone is consulted so that the vision of our implementation of NURA will be inclusive enough and every takers of health research, ang direction naman po nito ay mag-increase yung uptake at research utilization at the regional level. Moving forward, how to ensure alignment? There are several research priorities, but I will just present po the 3 research priorities from DOH, DOST, PCHRD. However, there are other research priorities of, like for example, NNC, the Philippine Philippine Plan for Action on Nutrition, the PITAC Research Agenda, and even the CHED Research Agenda, which is the National Higher Education Research Agenda. So for the updating, we will just base on the 3. First is the harmonized research agenda, research and development agenda. Next, the medium-term health policy and systems research agenda, which is also due on 2022, and also the National Unified Health Research Agenda, plus the NERA or the National Higher Education Research Agenda, which is later pa po siya matatapos, the 2028. For context purposes, the harmonized national research agenda is basically determining what are the specific priority research topics to be done by all regional HRDCs, and it is backed up with the prioritization of the DOST and different councils under po nun. Kasama na po doon ang PICARD, PShared, and everything else, and every councils pa po na under ng DOST. For the medium-term health policy and systems research agenda, this includes our universal healthcare. That's why in my presentation later, I will just focus on the number 3 of the medium-term health policy systems research agenda, because it focuses really on universal healthcare and its implementation. And the National Unified Health Research Agenda is a broader topics wherein every researcher can provide or submit their research agenda or research topics or research proposals for funding purposes. Why is that so po? So basically, these 2 research agenda, the DOH and the PCHRD research agenda, is broader so that it can scope everyone na pwede po nilang pondohan. And they don't want to limit the research agenda to specific topics as specific as possible, because basically they want to enable the environment so everyone can participate based on their interests and based on the needs of the country. And it is anchored with our ambition natin 2040. For the harmonized national research and development agenda, this is more specific wherein they determine specific topics or actually research output that they need to be funded for the health systems to become more responsive. However, the DOST recognize that there are variation in the capacity to conduct researches. Later, I'll provide you specific topics that they need and the topics that are prioritized for 2019 until 2022. And actually, based on the initial scoping review for the updating of the research agenda of the region, actually pasok siya dito sa ating harmonized and even sa national and medium term. So we are aligned. Next. So moving forward, for the National Harmonized Research and Development Agenda, for 2019 to 2022, they prioritize diagnostics, drug discovery and development, functional food, hospital equipment and biomedical devices, ICT for health, disaster risk reduction, omic technologies. So basically, all of the topics here is basically a priority of the Department of Science and Technology. So basically, ito po ay for 2019 to 2022. This includes our date now. So actually, if you can see, and if I may read po, for example, sa diagnostics, target identification and validation prototype development, laboratory performance testing, and field testing of diagnostic kits for 13 priority diseases. Basically, they based this on the burden of disease at the national level. However, they wanted kaya po nila nilagay ang diagnostics as part of the priority for 2019 to 2022. It's basically because they wanted to shift from the specialty care at the hospital level to a primary care setting, wherein ang focus po dito ay first, early detection of disease so that they may be prevention of disability or wala po talagang disability at the primary care level. At ang mapupunta na lang talaga sa special tertiary, secondary level of care ay yung mga malalalang sakit. So next, drug discovery and development. They recognize that the interest of many academic institutions is to develop drugs or develop medicines. And the problem at the national level and even at the DOH level is basically we do not have all of the capacity to basically ensure that there is available medications needed by the region, specifically kung ano po yung epidemiological demographics po na meron sa inyo. For example, sa drug discovery, DOST identified that nahihinto hanggang sa discovery and wala talagang drug development. So that's a question if the region will prioritize also the drug development part, not just only the drug discovery part. Next, for the functional food, safety assessment and characterization is part. Actually, they wanted to address here not only functional foods concern, but also food security and nutrition. And the food security and nutrition part is also identified by the PPAN research agenda of the National Nutrition Council. Next, aside from that, there is hospital equipment and biomedical devices. Congratulations to EVHRDC for having a capacity to train people who wanted to conduct researches on biomedical devices. For example, this is very timely now, is the designing and development of biomedical devices, which includes basically your primary care devices to detect disease or to screen diseases and PPEs. Next, ICT for health, meaning the proximity to predict possible epidemics. Actually, ginagawa din po siya ng UP ngayon, but basically, ang ginagawa nila ngayon is model forecasting. So, ito pong ICT for health, baka po may interested na institution. Or kaya din ba, or priority ba siya ng region? Next is disaster risk reduction. On disaster risk reduction, it was identified that intervention models to reduce prevalence on infectious disease is a must because of the changing climates. And post-disaster access to healthcare services, especially our people with disabilities and pregnant women and older persons. So dito po sa disaster risk reduction, kasama po ang reduction of infectious disease through interventional model and post-disaster access to healthcare services. Next is omic technologies like bioinformatics, technologies for health and wellness, and therapeutics. Why? Because basically, for the previous research agenda or research topics na identified, this is basically inclined to to more disease reduction, prevalence of disease na kailangan i-reduce. However, for omic technology, it's more advanced wherein they wanted to maintain the highest level of functioning and also promote wellness among individual or population. So basically, ito po yung nasa Harmonized National Research and Development Agenda. Moving forward, we will talk about the DOH. For the DOH research agenda, it was categorized na 4 or 5 sa kanilang priorities. One is we need to really establish the need. Is there really a need to conduct research on that specific area? That's why most of the researches na nasa Metro Manila, for example, is focusing on the development of the registries because they wanted to participate on really identifying what is the disease burden in a specific region or in specific locale. It was back also with the recent policy na community-based monitoring system of LGUs. So anchored din po siya doon. So all of the establishing needs, ito po ang mga priorities kasama ang health and nutrition status, health literacy, healthcare supply side mapping, health service and dimensions, and healthcare utilization. However, the priority of the Department of Health for the establishing need is basically health financing flow and burden and sector-wide resource requirement. Why? Basically, if you have epidemiological data, they can actually compute services needed and also provide funding for the services needed that is more accurate. So ito po, the font's too small, we cannot read. Are we given a copy? Actually, Ma'am Gloria, thank you for that question. Actually, we disseminated this po sa mga emails ng mga pinagsendan po ng ating survey questions. There are for national and there are for regional. So dalawa po ang mga documents. Kasama na rin po ang PITAP priorities. So going back, why health financing and flow? This is basically in support of the universal healthcare. What's the problem with health financing and flow and burden and sector-wide resource requirement? With the recent ruling of the Supreme Court on further improving the role of our LGUs to manage their health system at the local level, ito po ang mga programs at the Department of Health National is slowly shifting from individual-based to a population-based services. What do I mean with that? Si individual-based po, like for example, specific example is the MHGAP na medicine assistance or medical assistance program na wherein ang national government at the DOH level nagpo-provide ng medications and even training. However, in the pursuant to the Supreme Court ruling, ang mangyayari po, mawawala yung program na yon so that PhilHealth can provide a benefit package wherein the hospitals and even the LGU can procure their own medication based on the PNDF and other rules and regulations, and then sila na po ang magpo-procure at ang national government, which is the DOH for health, meaning po sila na po ang magpo-provide lang ng specific technical assistance and also population-based services like health promotion. That's why the focus of the Department of Health is health financing flow, burden, and sector-wide resource requirement. Moving forward for another DOH agenda is the identifying solution. So for the identifying solution, the research that generates elaborate system-based scalable solutions. Basically, ito po yung isa pang mga advocacies nila Dr. Huban, which is innovations in health. So, but basically, even though we wanted to have innovation in connection with financing, they wanted to have cost effectiveness and budget impact analysis. They wanted to have a broader research required to support resource allocation decisions through health technology assessment. Like for example, the recent initiatives of the of the DOH at the central office level is to just develop clinical practice guidelines. That's why they also issue the National Practice Guidelines Administrative Order. With the cost effectiveness and budget impact analysis, all evidences from the CPG. For example, there are new technologies, example of which is basically na ginagamit natin ngayon is telemedicine. The HTA wanted to check whether or not if the government will pay for telemedicine, will it be cost effective and will it reach as far as the GDA area for them to access the available services in their locality. So that's one thing na tinitignan ng HTA, that's one thing na kailangan for the CPG development. Baka po at the regional level, that's one of your priorities, the access through cost effectiveness and budget impact analysis. Another example is the HRH or RN Heals or NARS program of the Department of Health. Is it worth it? Is it the investment are worth it po ba? With the increasing of our the improving of our health outcomes, nagko-contribute po ba talaga ang DTTB natin, ang NARS program natin, or ang RN Health program natin? So that's one thing that the government at the central office level wanted to check on. And also, another from the Department of Health is ensuring accountability and also setting standards. Why ensuring accountability? Because basically, we are the national government is using public funds, and that research wanted to develop or provides objective assessment of program impact and designing accountability mechanism. Actually, now we are discussing how to evaluate the national health objectives. Are we meeting our targets? Lowering the prices of medications, better health outcomes, and so on. So basically, the evaluation, dissemination, and action. And lastly, for the Department of Health is setting standards. We want to set standards that is basically basic for everyone, for every person or our constituents. And this setting of standards will inform every policies at the national level. Basically because this research wanted to inform the development of standards that are critical in assuring healthcare quality and system efficiency. Aside from that, system efficiency is part and parcel of universal healthcare in compliance with the ARTA. Actually, there is one agency na nagtitingin dito, yung ARTA na council. So dito, cost accounting and price reference system. Why? Because we wanted to ensure that all healthcare institutions, based on the mandate of the Department of Health, is following the rules. A specific example is the drug price reference index. Why drug price reference index? The healthcare institution, or for example, the hospital, can only purchase within their 30% of their approved budget, but they can only sell medications na may 40% na markup price. Are they following that? So that's one thing na gustong din tignan ng national level before they will proceed with the maximum drug price ceiling na ini-impose po ngayon because of the COVID-19 pandemic. So they wanted to check on this, and these are their priorities based on the universal healthcare. Other important programs of the Department of Health are first is pursuant with the NICA law, or the National Integrated Cancer Control Act, and also the Mental Health Act, aside from the UHC law. So moving forward for the National Unified Health Research Agenda, so for the National Unified Health Research Agenda, actually na-explain na po ni Sir Ding. Actually, thank you Sir Ding, hindi ko na po isa-isahin yung NURA natin. So basically, ang priorities po ng NURA, I'll just read through it: responsive health systems, research to enhance and extend healthy lives. Next is holistic approach to health and wellness, which includes also the priorities of PITAC. Next is health resiliency, which includes climate change adaptation of the Climate Change Commission and also the ano to, yung ginagawa natin ngayon na kasama yung IATF. Next is the global competitiveness and innovation, which is also part and parcel of the initiatives of Dr. Huban, and research in equity. So for the research and equity, we wanted to emphasize that there are minority groups that needs to be emphasized in our researches, and we need to really check on them, because basically kapag sinabi nating na marginalize sila, hindi narinig yung boses nila in terms of research, in terms of policy, we are not inclusive, and we are not going to attain universal healthcare. This research and equity wanted to ensure that universal healthcare is on track and mas malapit po natin siyang ma-achieve. So moving forward with the National Unified Health Research Agenda is our Regional Health Research Agenda. How do we come up with a Regional Unified Health Research Agenda? We come up with several consultations last 2017, and published 21 health research priorities with consensus of the consulted stakeholders. So if I may just read it, you have service delivery, you have communicable disease, maternal health, health technology and development, healthcare financing, health governance, health technology knowledge management, environmental health, lifestyle diseases, disaster risk reduction and management and climate change adaptation, reproductive health and family planning, nutrition, mental health problems, health infrastructure, traditional and alternative health medicine, health promotion, health regulation, drugs, substance abuse, gender and development, geriatrics, and disability. Now, in our session later, we will discuss whether or not all of these priorities, kailangan na po ba natin siyang baguhin? Kasi po, ang question doon sa ating, before tayo mag-start ng ating prioritization at updating ng ating RUHRA, kailangan muna nating sagutin yung 8 questions. Is there any changes, and it's that changes significant enough? So basically, ito po yung kailangan nating i-double check. There are 21 research priorities, and ang question po natin sa inyo, may mga hindi na po ba priority dito before we delete or before we remove it? Or may mga priorities pa po na mas kailangang i-highlight. That's why kailangan natin i-modify ito. So moving forward with our discussions, hopefully sa ating secretariat, nakapag-provide po sila ng copy ng regional health research priorities. So next is, again, the updating of our regional health research agenda. We will answer 4 or 8 questions. And hopefully we can come up with a consensus to basically update it. So next, the health research topic generation. Basically, nasa second part na po tayo ng ating discussions. So, a gentle reminder again, close other applications and then open your Zoom and your internet browser. Go to Mentimeter, and we will use Mentimeter to discuss every topic. So again, ito po ang ating Mentimeter. Before we are going to proceed, hopefully nakaroon tayo ng screenshot nitong ating Mentimeter so that makapag-join po kayo, kasi po our first question will begin after this slide. So moving forward, hopefully may mag-thumbs up, mag-thumbs down, question, or mag-heart kung gusto nating mag-heart. Any participants who'd like to press the button for the heart, the question, the thumbs up, the thumbs down, kung okay na po tayong mag-start. Okay, okay na po ang EVHRDC DOST 8. So, again, because you are now part of our Mentimeter, please join in menti.com and use the code 3394783. Please just put in your name and your institution. My name is, and then your institution. So hopefully everyone in the room can participate in our discussion. Good morning, Ma'am Julienne. Good morning, Ma'am Marianne. Good morning, Ma'am Jean. Okay. From Gloria City Government of Tacloban, Ma'am Julienne, good morning po. Tama po ba? So 5. Ma'am Patricia of UP Tacloban College, good morning po, ma'am. We have 25, sana majority ang makapag-join. Sir Mark of RHU Leverzares, Ma'am Vicky of LNU, Sir Nap of DOH EVHRD RLED. Thank you, sir, for joining sa licensing po yung RLED, no? Okay, any other participants? We are 25 here or 24. Sana po naka-join lahat or karamihan sa atin. Hopefully makapag-join po. Ma'am Christina of EVSU. Okay. Good morning po, ma'am. 25. Siguro po at least 10 para makapag-move forward tayo. Or half. Yan ba to? 13. Sana po makapag-join ang iba para naka-half at least 50% of the attendees. Sila Ma'am Rose, sila Ma'am Robo, Solis, sino pa ba? Sir Ding, Ma'am Ellen. Ayan. Ma'am Ophel. Yan po. Kung hindi po, baka po dito. Ayan. Thank you, Secretariat. So we have 10. Sige po. We're expecting siguro 10 din later. Pag siguro okay na ito, ma'am. Okay na po ba ang 10 sa inyo? Okay, 11. Ma'am Charlotte of RHU General MacArthur. Good morning po. Sir Probo Quijano from RHU Bato Leyte. Good morning po. Siguro we can move forward. Sana po yung iba makahabol para sa ating generation of research topics. So basically, tatanungin lang po natin kayo kung ano po yung magiging priority at kailangan na po ba natin talagang i-update ang ating Regional Unified Health Research Agenda. So, okay. Sige. Moving forward, updating of our Regional Health Research Agenda will be based on the guidelines on health research prioritization. We have 11 participants here, in the 11 participants in our Mentimeter. However, we have 27 participants in our Zoom account. So for the first questions, we will be dealing with answering, have there been any changes in epidemiological landscape, socioeconomic landscape, political leadership, health policy, environment. The political leadership also includes the leadership within your institution, not only sa ating mga LGUs. So, moving forward, have there been any changes in epidemiological landscape? That's a question for everyone. Do you basically agree that there are changes in the locality or Eastern Visayas? So hopefully everyone, kung tayo po ba ay nag-agree or nagdi-disagree sa epidemiological landscape, makikita natin dito. So eto, may isang nagsumagot na yes, strongly agree. May strongly nag-disagree naman. So may isa ring sumagot. Hopefully yung 11 ay makita natin kung ano po ang kanilang ang kanilang mga nasa loobin, kung nag-change po ba ang epidemiological landscape. We have 3. We need more para po siya ay maging 11 kasi 11 po ang nag-register. We will use also tools like mean, median, and mode so that we can really identify. Tomorrow, I'll present it to you for transparency purposes. So we have 7. We need more pa po, mga 3 para maging 11. So mukhang nagbabalance. Okay, mukhang mas maraming nag-agree na there's a change in epidemiological landscape and we need just 1. Naka-join na ako. Okay. Thank you everyone. We have 11 or 12 votes. Thank you. At least meron tayong karamihan sa inyo ay nag-agree at kaunti po sa atin ang nagdi-disagree. Ang iba naman po ay neutral. So, let's move forward. Next, have there been any changes in socio-economic landscape? Do you agree, disagree, or that's neutral? Or hindi nyo po alam kaya kayo sumagot ng neutral? Sir Ding nag-yes po based dito sa ating chat. Sige po sir, ilalagay po natin yan dito sa ating Mentimeter. So hopefully, maka-12 ulit tayo. May nagbago po ba sa socio-economic landscape? Kaya natin kailangan baguhin ang ating Regional Unified Research Agenda. So 6 na po yung sumasagot. May nagsasabi na yes at karamihan yes din ang sagot nila. Nakakalito yung choices sa Mentimeter. Actually, that's a template po. Why 5 lines? 5 lines po kasi po kailangan lang po ma-establish yung strongly agree, agree neutral. Which one do we choose? Kung meaning po nag-disagree po kayo, you choose po strongly disagree tapos yung pinakadulo, and then strongly agree kapag dito naman po kayo nag-agree. Yung pinakadulo na din po dito sa ano po. Okay. We have 10. So we still need 2. Strongly disagree, strongly agree si Dr. Lim. Okay. Thank you, sir. Sa Secretariat, hopefully recorded po ito so that based on statistics, objectively, we can really check and we are really transparent enough to basically deal with the comments of our stakeholders. So moving forward, have there been any changes in political leadership? May change po ba sa political leadership? Leadership, for example, is the leaders, the person na nandun sa institution nyo. Aside from that is the political, meaning political priority of your institution, even your mayor or the direction of your institution. Naging COVID ba siya lahat? Naging access to medicine ba siya lahat? So, is there any changes in political leadership? My chat, better if you quantify in the last year, last 3 years, last 5 years. Okay po, for the political leadership, we can start from the generation of our RUHRA. So that's in 2017. From 2017 up until now, is there any changes in political leadership? You can change your answer basically by choosing whether or not kung nag-change ba siya or hindi ba siya nag-change. Thank you, Ma'am Marian, for your comments. Okay, we still have 10 or 2. Agreeing during last 2 years. I agree during last 2 years, Dr. Lim. So we need 2 more para sa ating political leadership. Is there any? So nag-1 na si Sir na nag-agree po siya. So, last one. Anyone na kailangan pa? I'll just take note of that. Okay. I think we can move forward. Moving forward here. So next, have there been any changes in policy environment? Health policy environment from 2017 to 2020. Is there any health policy changes? So as mentioned, last 2018, I think that's our Mental Health Act. We also have universal health care. We also have NICA law. We also have community-based monitoring system for the LGUs. So hopefully everyone can provide their inputs. Ngayon po, tinatanong lang natin kung may pagbabago. Pero later, kailangan din natin sagutin kung significant ba yung pagbabago. So moving forward, we have 6 of our participants na nag-participate. I strongly agree from Dr. Lim. Thank you, sir. We have 7. Plus 1 from the chat, meaning there are 9 na kasi 8 na dito. So still need 2 or 3. Hopefully everyone can provide their answers. Sige po. Hopefully everyone can provide their answers. 9 po ang meron tayong inputs. Okay, 10 na po. Sige. Last one na lang siguro. From Ma'am Gloria, and change can either be positive or negative. Yes, we agree with that. Nag-agree rin po si Sir Ding. So basically we have 10 or 11. So moving forward, this is a yes or no question now. Are the changes basically significant enough for us to move forward with the research agenda setting? First, are the changes in epidemiological landscape significant enough? Can you provide your answer? Is it a yes or a no? Hopefully, everyone can provide their answers. May 3 or 4 siguro dito. Dr. Lim, yes. Okay, there are 4. Okay, 7 na po. Last 3. 7. And then 8. Okay, 9. May nag-no. Let's have one more. One more. Dalawa na po ang nasa chat. Just one more. Okay. Okay, wala na po ba? Okay, sige. We will move forward. Is there any significant changes? Okay, next. Sa socio-economic landscape naman po ba? Is there any significant change sa socio-economic landscape? Yes po ba yan or no? Marami po bang naghirap? Marami po bang yumaman? Marami po bang marami po ba ang number ng matatanda, number ng PWDs? So, number of low-income wage earners, nawalan ng trabaho, mga ganyan. Nag-yes si Sir Ding dito, plus 7, 8, and also 9. Okay. Meron tayong 9 respondents. Next. Sa political leadership, nag-change po ba sa political leadership or political priorities for that matter from 2017 up until now? So nag-yes. May nag-no. Okay. May nag-no talaga. Okay, sige. Meron tayong nag-yes uli si Dr. Lim. Thank you, sir. And Sir Ding. Okay, last one, siguro? Okay. So at least nakikita natin that there is a significant change in political leadership. So next, last question is there or are there changes in policy environment significant enough? So ito po bang policy environment ay nag-change ng malaki with the UHC, with the Mental Health Act, for example, with the NICA law, for example, with the Rare Disease Act, for example, nag-change po ba siya? With the recent issuances of the IATF, so nag-change po ba siya? We have 7. Baka sila Sir Ding at saka sila Dr. Lim ay makapag-provide ng answer sa chat. Okay, yes. And then may nag-8. Okay, nag-yes din siya. Sir Ding is nag-yes din po. So thank you very much for participating. Now, we will not analyze this po ngayon, pero I will present this tomorrow for transparency purposes. But we will proceed with soliciting your ideas or based on your practice, ano po yung priority health needs ng region. So, for question number 1, ito po ang question natin. Oops, ano to? Wait lang ha. Ang question number 1 ay, wait, ayaw niya gumana. Dali lang po. Look at your phone and what do you think should be the priority health needs of Eastern Visayas? You can provide your answers po, as many as possible po. So please type in your answers. Okay, we will just go back. Dali lang ha, ayusin ko lang. Stop share lang po ako. Stop share and then I'll just present it again. Dali lang po. Aha, bakit hindi gumana siya? Dali po. I-delete ko lang po yung duplicate and then gagawa po ako ng isa na open-ended. Apologies po sa live at technical issues. Okay. Okay, now I'll just present it again. Okay. Hopefully everyone can see it. Hindi pa po ba? Ayan. Oops. Ayan. Okay. Hopefully you can see it now.
Not yet, sir.
Not yet. Okay, wait lang po Oh, bakit ganun? Stop share. Ayan, meron na po. So hopefully everyone can provide your inputs. What do you think should be your priority health needs of Eastern Visayas? So please provide your answers. So basically, all of the data here for Eastern Visayas will be the priority research topics of Eastern Visayas Health Research and Development Consortium for 2021. So hopefully you can provide your answers sa magiging priority ng region for health for 2021. Hopefully you can provide as much as possible. You can provide now because this data will be analyzed and this data will be the priority for funding at the regional level and even at the national level for if that is a big ticket project. Everything that is not written, just a gentle reminder, is not counted or not proposed. So ano pong mangyayari sa mga previous research agenda? That will be part of the data and that will be analyzed also. And yun po ay ilalagay din natin bukas at ipe-present din po natin bukas. So hopefully sa 24 na nandito sa ating Zoom, you can provide po your priority topics or priority health needs in your local or based on your mandate or based on the interests or PGS of your institution for specifically for government agencies. So we have 4 topics. Meron pa po ba na priorities? Nutrition lang po ba? Vaccination lang po ba? Food safety and nutrition? Mental health? Health systems development that is adept to political, geographical, economic et al. Of the province or city? Nutrition provision of services and facilities, increased dissemination of health programs. Thank you po. Biomedical devices, okay, that is well noted. For Dr. Lim, infectious disease, behavioral, herbal medicine research. That's well noted, Dr. Lim. Mental health and psychosocial concerns. Thank you po. Any more? Any more pa po? Siguro we can time ito ng 5 minutes if ever. Or sabihin natin 2 minutes para 2 minutes 30 seconds para lahat makapag-provide ng answer. Okay. So until voting closes, hopefully meron pa po ba dito sa chat box? Genetic and molecular studies on antibiotic resistance. Yes, sir. Actually, sa national level, pinoproblema na yung antimicrobial resistance and even antimicrobial stewardship. Another one is dengue drugs. Ang pinagmulan, sir niyan is yung paggamit ng mga antibiotics para sa pagkontrol ng COVID. Kaya naging problema. So next is from RHU, disaster management, traditional and complementary and integrative healthcare. PITAC, ma'am, thank you. Sir from RHU, Lever Zares. Sir Mark, thank you po. We also have another vaccination. So vaccination is quite important right now. Okay, we still have 1 minute 18 seconds. So hopefully everyone can participate and provide your inputs. Unless nasulat po natin dito, hindi po natin ma-analyze yung hindi po natin naisulat. From Dr. Lim, we need population control measures in compliance with the Reproductive Health Act. Also, behavioral studies to related diseases. Thank you. Ma'am Jean from SSU, since Ms. Labid got disconnected, reproductive health is also important. That is well noted po, Ma'am Jean. Okay, we have 35 seconds. Hopefully, everyone can provide their answers para po ma-analyze natin. So mamaya po, I'll provide din po mga topics na nakuha sa survey. So si Ma'am Jean, meron silang, Ma'am Jean again, waterborne diseases. Thank you, ma'am, for raising that. Also, Dr. Lim, we have healthcare delivery system studies. Thank you. We have 6 seconds. Non-communicable molecular diagnostics, and we're closed. So we have common communicable, non-communicable diseases, molecular diagnostics. So before we will go to the last question and the last slide of my presentation, before analyzing this, I will present to you kung ano po yung result muna ng survey. So first, we get their informed consent, and there's one na nag-no. I will not deal kung sino po ang mga nag-yes. So basically, there are more female na respondents, and there are 5 male respondents. The ages of them on basically on the mode part ay dalawa na nasa 60. On the mode part again, marami po sa Palompon Institute of Technology na nag-answer. Another mode for the addresses from Palolete and also from Tacloban City. For the contact details, I will not go into it. Next, for the research agenda, have you read the research agenda and downloaded it? So basically 11. So hopefully yung iba po na dalawa makapag-download ng research agenda. So next. Next po. Meron tayong ano po yung priority health needs. So, babasahin ko lang po for transparency purposes. We have vaccination and infectious diseases, wherein vaccination is also part of the suggestions now. We have health programs for elderly, which is not part of the Mentimeter. Safe working condition for productive workforce and programs on malnutrition. Ito pong safe working conditions of productive workforces ay hindi rin part ng Mentimeter. That's why we will add that. Lifestyle diseases is not also part of the EVHRDC na Mentimeter, so we will add din pa rin po ito. Another one is health and nutrition, so may nutrition and health, okay. May mental health, specific to children and teenager and women. Infant and maternal health. Infant health is not highlighted. That's why we will add that in the disasters. Also, disabled children and adults is not part of the Mentimeter input. So, isasama po natin. WASH is part, health and sanitation is part. So, basically, kasama na po siya. Hindi po lumabas ang COVID-19 pandemic, pero vaccination ang lumabas. So, pero po dito sa response natin, meron tayong COVID-19 pandemic. Also, the immunization specifically related to the controversy on Dengvaxia. Next is the impacts of natural disasters, which is basically more of climate change, adaptation, and health. Aside from that, hindi lumabas sa ating Mentimeter ang health promotion. But lumabas ang health regulation and hindi rin po lumabas ang health technology development. So basically, this will be added. Next, TB or tuberculosis is not present in the Mentimeter. That's why we will add this. COVID again, COVID, TB, and health regulation. So we will add those. Next, nutritional status, health facility and services in far-flung, especially in GIDA area. So basically, isasama natin yan. Actually, ang context nito is access to health services. So increased dissemination of government health programs or the health promotion acts, researches po pala, basically isasama din po natin kasi hindi po siya lumabas sa ating Mentimeter. So next is yung school health of our children is not part of the Mentimeter. That's why isasama rin po natin siya. Manchan, UHC, and NCD. These are all included in our analysis of all the data. And all of this will be presented tomorrow. And the suggested or recommended will be for appeals. So moving forward with our Mentimeter. So, balik po ako sa Mentimeter. Hopefully, nakikita nyo na siya. Now, pagbalik ko sa Mentimeter, ito na po yung last question. Ang last question is, what do you think should be the priority? Health needs. Wait, parang naulit yung question na yon. Nawala na naman si question number 2. Ang dali lang po, ayusin ko lang po ulit. Stop share lang po ako. Sandali lang po, nagkaroon uli ng technical problem sa Mentimeter natin. Okay. Exit. Okay, ito ay for sandali lang po. Escape and then share. So ayan, here you go again. Bakit nawala? Okay, share again. Ayan. So basically, the second question is, what health research projects need to be done in your region with the current priority? Ano po ba yung health research projects that needs to be done? Kasi po, ang topic medyo malaki. Dito sa sa second question, ano yung context? Ano ba yung dapat gawin para ma-address yung topic or problem dun sa topic na binigay ninyo? So hopefully everyone can participate in this second question. Ano po yung dapat nating gawin to address the health needs na na-identify na kailangang priority sa ating research agenda? So this will be also a part of our analysis of data tomorrow. Later, after this Mentimeter, ipe-present ko rin po ang nakuha natin sa survey. For everyone, hopefully you can provide your answers. So we have 2 minutes 30 seconds. For everyone po na wala pa sa walang Mentimeter, you can use chat. Hopefully yung ating secretariat naka-note at pwedeng ma-share itong mga data. So kailan po nangyari itong survey na ito? That was last week, Dean Patricia. That was last week po. May mga nagbabounce na emails. I don't know kung bakit po, pero ito po ay ang binigay lang sa atin ng EVHRDC. We just received the link this morning. Noted on that, ma'am. You can always answer pa rin po. Yes, ma'am. So there's one answer here. Some answers with the survey since my answer was very long, and then there are some same answers. Okay. Sige po. Noted on that. Hopefully you can add pa po. Siguro per topic po isang entry. So dinadagdagan ko po yung oras kasi mas mahaba po ang kailangan natin dito. So ayan, 4 minutes 30 seconds. So zoonotic is important, those transmitted through animals and insects. Actually, tama po kayo at pag-uusapan po yan, ipopromote ko lang po yung One Health ng University of the Philippines sa Mayo TroCmed pag pinag-uusapan na po kung paano yung mga zoonotic researches under the One Health initiative, which is basically in alignment with the WHO and priorities po na mga researches. So hopefully makapag-provide po pa po tayo ng answers, even sa Mentimeter or sa chat box. So one, policy research on COVID-19 protocols. That's important, ma'am. Actually, I love that dito idea na we need to really check the policies on COVID-19 protocols. Na kasi nakita namin when dealing with LGU sa isa pong USAID project with the Philippine Society of Public Health Physicians and USAID, nakita namin naguguluhan ang mga LGUs in terms of how do we really implement COVID-19 protocols issued by the IATF. So we provided technical assistance on that. We also have here from Ma'am Marian, in addition, health project on economic evaluation of programs and their socio-economic impact. That's important din, ma'am, because we do not want to invest on something lang, but basically we wanted to monitor it if it's high impact intervention. We also have here family and community factors in mental health. That's important, sir. Actually, in terms of health-seeking behavior, those who are in the low-income bracket has low health-seeking behavior in terms of accessing available mental health medications. Pero po, kapag for example, nanay ay nandoon sa kanyang bahay kasama ang ibang kasama ibang kapamilya, actually mas mataas ang health-seeking behavior even though mahirap or sabihin na natin nawalan ng trabaho. So next, basically national IATF should consult local, not just DILG. That's, well, ma'am, that's true. I cannot comment on that. Next po is participatory role of civil society in health RDE. So we will take note of that, the participation of NGOs. In our Mentimeter, we have one, conduct a study or research on developing PCR-based diagnostic procedure for communicable diseases and non-communicable diseases like cancer, taking advantage to rising numbers of molecular diagnostic laboratories. That's important, ma'am, no? Kasi currently, I'm checking the prices of PCR. It ranges from 1,400 to 6,000 pesos. And ang nagpapamahal sa kanila is yung urgency na makuha mo yung result. So ayaw naman natin na nagbabayad tayo ng same quality of technology pero yung time lang talaga ng paglabas ng result. Ayaw nating pinagkakakitaan ang fellow Filipino people. Next is food science and technology, particularly on the development and improvement of food products in terms of nutritional value. That's a priority of all of our DOST FNRI, also with our National Nutrition Council. Yes, ICT for Health. Actually, the priority for ICT for Health is the registry of all diseases, non-communicable, communicable, which is basically based on the ICD code. Next, from PIT, Project for Utilization of Herbs as Disease Cure. Actually, sir, that's part of the PITAC priority research agenda. Paano ma-integrate ang herbs at paano i-utilize ang herbs as medicine or complementary medicine for that matter. VCO is medyo maingay ngayon. So, yun yung inaano nila sa COVID. So, yan. We have both from chat and also we have from Mentimeter. So, si Ma'am Rosa, shall we consider local institution, farmers association, co-op association in the role of civil society in HRD? So that's important, contextualization on identifying our stakeholders. We will take note of that and we will also have it recorded in our analysis. So moving forward, I'll present to you the results of the survey. So ito po yung sinabi naman nila. What are the health research projects to be done? One, vaccination campaign, which is not part of the Mentimeter na second question, but part po siya ng unang question. Next, assessment on the health needs of the elderly. Actually, lumalabas si elderly dito, pero sa Mentimeter, hindi siya lumalabas. Next, ergonomics in the workplaces. So, ang question actually dito is, how do we define now workplaces? In IATF, with one of our discussions, defining workplaces now is very crucial because basically in every place, workplace na siya. Dahil doon na rin nagtatrabaho yung tao. So how do we check for the ergonomics para safe din po ang working environment? Next is sustainable strategies to mitigate malnutrition. That's important also, or undernutrition. Next is those include in the top 10 morbidity and mortality, infectious disease, cancer, CVD factors affecting delivery of healthcare services. Next is food innovation for nutrition needs per age group, survey on mental health issues. So we have mental health, projects which identify prevalence of infant maternal morbidity. So thank you for that, especially during disasters. Next is research on programs and guidelines, which is basically part of the COVID-19 then policy review. Another one is to speed up the vaccination of the critical mass population. Also, especially the protocols. We also have enhanced motivation activities for mother to submit their children for immunization. So basically, meron tayong special immunization which is for COVID. The next one is yung siguro yung MMR kasi naglabas yung WHO na medyo mababa ang ating dito immunization rate for MMR. So now we have improvement in the LGU capabilities for prompt action for relief operations. So for flooding to, basically disasters. Next is research on various available media in the region. So more likely of health promotion po. Next is conduct research on why there are still sari-sari stores selling antibiotics. So that's one thing for the antimicrobial stewardship. Do we lack manpower, resources, policies, etc., etc.? We have also to have research on novel responsive methods on disease surveillance, telemedicine, etc., etc. po. So basically, improvement and innovation of technologies. Also, we have knowledge on universal healthcare law among healthcare workers. Next is development of anti-SARS-CoV-2 antibody among COVID-19 positive patient. Actually, itong zero prevalence, ito ay clamor po ng lahat and wala pa po masyadong gumagawa ng zero prevalence. Actually, ang alam ko lang na gumawa na region is Region 3 with San Fernando, Pampanga. So next is study that will address gaps and limitation of direct sputum microscopy and the RT-PCR detection of TB. Etong part po na to, DSSM at saka RT-PCR, it's basically a challenge for HFDB of the national government kasi po mas feasible at the primary care level yung DSSM kaysa sa RT-PCR. So kailangan po nilang mag-work on it po. Next is factors that contributes to common non-compliance for health facilities to standard requirements. So it's basically licensing requirements of health facilities. Why are they failing failing to comply the requirements of the licensing? In our study po sa ating friend din sa Western Visayas, yung mga facilities na chinek namin at the regional level, ang common na kulang nila is thermometer. So magtataka kayo kung bakit thermometer, kami rin po nagtataka kung bakit thermometer ang kasama. So next is free medication and regular checkup. We can check on this in IR or implementation research and social innovation research on Manchan, UHC and NCD. So this is well aligned with the innovation initiatives of Dr. Huban. Burnout studies for frontliners, basically it's related to mental health and it's important right now. coverage and health impact assessment of COVID-19 vaccine. So it's good din po. Also, assessment to current climate change adaptation strategies and health facility capacity assessment on health emergency. So basically, ito po yung second questions and we will present it to you na mas maayos po tomorrow. Kasama po ng Mentimeter at saka ng nasa chat box. I'll be reading again sa chat box. So may free, yes po, I am suggesting with the last suggestion of Dr. Lim. Another one, role of parenting on the psycho-emotional health of families, especially on children, both husband and wife relations, health governance among local chief executives in times of disasters. Yes, we acknowledge this po kasi iba ang tingin ng CHO, tingin ng LGU chief, iba rin po ang approach ng LDR, RMO sa LGU level. And lastly, from Ma'am Rosa is strengthening the role and capacity of health units and workers. With that po, I end my presentation here. Tomorrow, I will present all the data to you and all the suggested or recommended na priority topics based on the inputs from the first consultation, which was done by the EVHRDC. Also, this consultation plus the survey. If you have time to answer the survey, hopefully you can access it. I will send it again po later. So with that, I'll turn over the floor to our EVHRDC Secretariat. Thank you very much.
All right, thank you, Sir Teddy, for that. Also to those who participated the activity. So that ends all the presentations for today. So just a heads up, tomorrow we will be providing you a recap of what transpired today. And Mr. Teddy Dizon will also refine the health research agenda thematic area. So I have also taken down or took notes of those of the suggestions or topics chatted or they put in the chat box, and also from the Mentimeter, so we can share with you, Sir Teddy. Also, we will tomorrow. Sir Teddy will also prioritize the updated regional health research agenda, and it's the last day tomorrow for this consultation. All right, so it's already 30 minutes past the hour of 11. Once again, you can access the Mentimeter. We will provide you the link and the password for that Mentimeter and for the activity that we had earlier. All right, so that's it. Thanks everyone for your participation. We encourage you to again participate tomorrow because there's only one goal that we have here. That's really to improve the lives of the Filipino people and also the people in Eastern Visayas. All right, so once again, thank you so much and enjoy the rest of your day.